Great stuff. I am going to be a little bit different, I think, to every other presenter today. I'm going to be talking about how we've been doing this kind of work that we've been hearing all the research about this morning and all of the evidence and the policy. My job, I guess, is to take that research, that evidence and that policy and put it into action. So that's what I'm going to be talking about in the context of Cork City and the role that I have as the Healthy Cities Coordinator. I'm based within the HSE. I'm the only Healthy Cities Coordinator based within the HSE, so I'm a little bit different to my Healthy Ireland colleagues from that perspective, just to set that context. Cork has been designated as a WHO Healthy City since 2012, so that's it's 13 years now. The decision was taken, that was well before Healthy Ireland framework was in place. I suppose it was taken by a few forward-thinking directors in Cork City Council and forward-thinking managers in the health promotion area of the HSE. And it really was about the first step in the local authority and the health service coming together. When I speak to a room not full of public health professionals, I talk about how my role is upstream and how health service people, generally my colleagues in the HSE, work downstream, pulling people out of the river in the analogy of people drowning in the river, and that I have the luxury of being upstream saying, why is it that people are falling into the river and what can we do? And my job might be, for example, if there is a problem with the bridge, bringing an engineer, bringing the Gardaí, bringing the local community development project together. So it's not the doctor or the medical professional at the bottom of the downstream, dealing with it that I would bring together for that. It's people who work in the social context in which we all live, and that's my job. Another way to describe this, and something I learned a long time ago through a project we had back about 15 years ago called EcoWell, where we were looking at how we all work in silos and we're all used to working siloed ways. We're trained, we're educated in siloed ways through our third level system. And we tend to talk to people in our own world, but not beyond when it comes to professional engagement. We decided to try and break that down a little bit by looking at education, economic development, health, and the environment, and we called it EcoWell. It was a theory that was brought forward by someone from a professor in Australia. And we said, how about we try to give this a go in Cork? So the idea of this was the cross-fertilization of ideas. And this is another way of me describing my job. I would consider myself the bee in this scenario, where my job is to cross-pollinate and to share ideas among professions and find common language, because we don't operate with common language, even in terms of some of the presentations today. That the language of research and the language of policy can get very lost for practitioners and for the general public. So really it's that Medici effect of, the intersection of ideas and approaches that can really have an impact. And I've seen that I've been working in this area for 15 years. I obviously really like the job, but I have seen how this approach really works. So what we've done in Cork is we have taken all of our Healthy Cities actions, which we have to align and develop under the framework of the Healthy Cities framework from the WHO, and we've made sure that they all align with the SDGs. Now, that's a very easy paper exercise to sit down and just put your SDGs with every action, but we're very committed from the start to actually realising that and not just having it in chapter 1 of our action plan, which a lot of our policies in terms of, I would argue, in health and health promotion, we talk a lot about best practice, and then the translation of it in action sometimes gets lost. So we're very committed to it in terms of our action plan. The way we started to do this was before my colleague Peter Medway from Cork was in his role. There was a bit of work in Cork City Council around climate adaptation. So it was about how can we adapt to the climate crisis that's coming and how can we mitigate it as much as possible. And this is about 10 years ago. And we were looking at how we can, in a Healthy Cities context and in our work, do something. So we held an event, and I think it was a great approach and something I'd recommend for other areas to use. We held an event with that EcoWell structure where we got experts from various topics connecting health and climate action, and we got them to speak for just 3 minutes. Imagine asking an expert to explain their field in 3 minutes. It's a very challenging thing to do, and without slides. And then we invite the participants at the event to join the group of the person that they feel they can contribute an idea to. And the approach was based on the expert being there, not to say what needs to be done, but to challenge the queries or the suggestions that people were making. But the people in the room weren't just the general public and the community, and there was plenty of them. It was also stakeholders. So there was engineers, there was planners, there was health professionals, there was community workers, there was researchers, there was experts in various fields, and they were all sitting around together and they were talking out things like food systems and energy and water and biodiversity. And out of that, we got a really strong action plan, and we built that into our Healthy Cities Action Plan. But at the same time, we submitted that to the Cork City Mitigation Plan. A great thing happened in 2022 and was probably the time I could retire, because we got health put into the city development plan for the first time as a strategic objective. So in Cork City, we made a big submission. We'd been submitting all the time to city development plans over the last 15 years, but there was a strong commitment in the 2022 to 2028 Cork City Development Plan, and one of the key strategic objectives is that Cork becomes a healthy, inclusive and diverse city. So we use that now as our mandate to get work done. We've already talked about all the ways that health and climate overlap, and I suppose what I'm going to take you through now is a very whistle-stop tour of how we do that in practice. The 15-minute city was mentioned here. There's an ambition in Cork City Council's city development plan to become a 15-minute city, and there are strategic actions around developing that. So that's happening in practice despite some concerns, and there's discussions and there's ways around it and thoughts around it. That is starting to emerge through the work in the city. We also carried out a health impact assessment on the city development plan, which, as you can imagine, is huge. It was the first time it was done in an Irish context. When I say we, it was my colleague Monica O'Mullane in UCC. She sits on our steering group. She led that with the planners and with other key stakeholders to it, and they did it on the 15-minute city. So the health impact assessment was looking at the health impact of the 15-minute city in Cork City, and that's published and available online if you want to have a look at it. That was our way of bringing health into the discussion in terms of the city plan, but also from a climate perspective. Another approach that we took about back in 2018 is we got the opportunity to get some European funding. Now, I was having a discussion with somebody earlier that my biggest concern around this whole area of climate and health is that a lot of the money coming from Europe is going into research. And as a practitioner, we are not getting funding for actions. And we believe strongly that we know what we need to do. We just do not have the funding to get it done. What happens is we get dribs and drabs of funding. But this project was an URBAC project, which allowed us to share practice across Europe, and it was around play. So Healthy Cities in Cork became a member of that network in Europe, and we were invited to replicate what was going on in Udine in a city in northern Italy. Out of that, we decided we would take a placemaking approach using play as a way of engaging people in public spaces. And when we went to Italy, and one of the Saturday mornings that we were there, we witnessed how they transformed a plaza in the centre of a city into a play space by just literally dropping some play equipment. Literally, children came from everywhere, and it was transformed in no time. And we said to ourselves, we will never manage to do this in Cork. Firstly, who's going to cover the insurance? The weather, we don't have plazas. We were thinking of all the negatives in terms of Cork, but we said, look, we still have to try. We're in this project. Let's try something. So what we did is we went down to the marina in Cork City, and we, there's an image here of it, with the car, that's a picture of the marina before we started. We said we were opening the street to play. We didn't say we were closing it, even though we were closing it to cars. It's a 2-kilometre stretch. We said we're opening it to play. And we did that for 4 Sundays in the month of October, called Urban October, which is a city revitalisation project that was going on in the city. And it was an overwhelming success, so much so that that area has now become permanently pedestrianized. That's all the political interest in that. As you can see, it's become a playful space. There's a greenway there. Now, I'm not saying that came out of this small intervention, but that whole area has been transformed by that pedestrianisation. It's now a space for biodiversity, for walking, for cycling, for getting to the city in a more healthy, sustainable way. And it was just a simple intervention that can happen with multiple stakeholders. It's led to a whole programme of open streets that Peter and his team lead through climate action, which again isn't about closing the city, but opening it up to other people beyond car users. Cork City has a clean air strategy. It's the only local authority, I believe, in Ireland to have a clean air strategy. I've worked with that department. As a result of the pedestrianisation on the marina, we would argue that Cork City Council developed a really strong confidence around pedestrianisation, and during COVID, pedestrianised 17 streets in the city centre, which remain pedestrianised to this day. And they have now declared those clean air zones. And that's a really exciting, I suppose, progress again from a small intervention over 4 weekends, very small. We've never measured at a research level the impact of that, but that's leading to more and more work. It also led to some work on a behaviour study, which was a Science Foundation Ireland funded study on how we can nudge people to change their habits around air quality. And finally, we're working with the Climate and Health Alliance now on a position paper on air quality, and Cork City, different stakeholders are involved in that. So we're not just doing it at a tiny micro level in the marina in Blackrock. We're always looking at how we can impact in terms of strategy and policy, and we're hoping to impact at a national level with that position paper. Another very quick one is community gardens and allotments, very important. We got some Healthy Ireland funding through the local authority, and we hired somebody for Green Spaces for Health. She's done an incredible project in Toker, where we convinced the city council to provide some land to develop a community garden there in a public park. It was the first time this has been done. Now, this was work that had gone on for about 4 or 5 years of building the trust and the confidence of the city council to give us this land. It was eventually given. This is in an area of disadvantage. You'll see there that we were told don't even think about putting a polytunnel in this area, it'll be destroyed. That polytunnel is still there and working magnificently. They've done incredible work. They've won awards from everywhere, from the LAMA, the local authority management agency, to the city council, to the Lord Mayor's awards, to multiple different awards for the level of work that's going on there. They've taken a One Health approach to that garden. It is a living lab of how to do community engagement, and former speakers have spoken about social prescribing. It was a social prescriber that said, a lot of people in this area would love to have a community garden, and it came from there. And out of that has grown this real interest in the environment around them. They're not just growing food, they're talking about the food system. They're sharing food together at the end of every session, twice a week, Wednesdays and Saturdays. They share the produce. They produced that cookbook that was at the start of my this cookbook for children from produce from the garden, and it's basically like an educational space, and they're taking a permacultural approach in an urban context. So they're using the principles of permaculture to enhance biodiversity and grow food. And very quickly, we have a Food Policy Council in Cork. Again, I think we're the only ones in Ireland to have that. We like to call ourselves the real capital. We also like to call ourselves the capital of food in Ireland. I don't buy into all this pro-Cork stuff, but we do have a Food Policy Council. My knowledge of the food system going into the Food Policy Council as a health promotion officer, trained with my master's in health promotion, was the food pyramid. my experience of working, we'll say, as the honeybee in that situation was learning so much about the food system and how complex and difficult it is to deal with. How we're trying to deal with it in Cork is a whole other presentation, to be honest, but we have started that Food Policy Council 10 years ago. We've done a lot of work in terms of community food growing. There was a map there at the start. There's about 22 community food growing spaces now across the city, but that's not producing enough food to feed communities. That's just giving people a sample of what they can do if they grow food. So we participate now in a Horizon project, again, predominantly funding the research side, not giving us enough money to really have impact. We're involved in Feast, which is this broad-scale Horizon multi-million euro project for research. We have a tiny amount, and we've hired a food policy officer for the city, and that person had to be based in Cork City Council. And that person is working on a living lab where we're growing food for a local community at a market garden level. Our biggest challenge in terms of food at our level in the city is lack of access to land. We cannot, for some reason, access land to grow food for the city. We've loads of people ready. There's a permaculture college in Kinsale. There's graduates out of that every year. Their biggest barrier is accessing land to grow food, because land is predominantly given to dairy, farming and housing at the moment, obviously, as well. We also did some really interesting work around the Place Standard tool, which is a Public Health Scotland tool, and we took the lens, we've adapted it to put the lens of the food environment on it. Food environment is not good in Ireland. I don't think I need to explain that to any of you. We're living in we're going from food deserts to food swamps. So we go from places where there's not enough food to where there's too much fast food. So we used the Place Standard tool in the Sláintecare Healthy Communities that was presented on this morning. We adapted it for that space because we wanted to look at what's going on in this place, as opposed to just delivering education programs into an area of disadvantage, looking at what's going on in the food environment. And that tool was excellent in terms of really educating people around that. So this is our test site for our Horizon project. We're developing a food policy for the city. We managed to get that in through the LCDC and the LECP, the Local Economic and Community Plan. And we have managed to swing it that it's an interagency food policy. So our hope with that is that if somebody politically decides, that they don't want a food policy in the city council, it's still in existence because it's a multi-agency strategy, and I think that's the way to go. So thank you very much. I suppose just to finalise that we can focus on individuals, we can give them information, we can teach them, we can focus on the environment and enhance the setting in which people are living, or we can think of it at a global level, which is what we try to do. So while we work at a small level in Cork, we try to influence national policy and we try to impact in terms of European policy. And Cork and Limerick, only yesterday, myself and Olivia, my colleague in Limerick, have now been asked to lead a task force on food systems, climate and health for the WHO, and we're really looking forward to being able to talk about that in an Irish context.